Hello everyone, this is I will teach you medicine. Today we are learning about cardiac poisons in toxicology. So without any further ado, let's get started. So cardiac poisons include aconite, quinine, aconite, quinine, and then nicotine and oleander. Okay, so let's read about aconite. So aconite is like a very toxic plant. Okay, it has like cardiotoxin. It has like cardiac poison properties. Okay, so this is a very pretty purple colored flower. Okay, so it has many other names. Okay, so but you can read from the list, but my favorite one is queen of poison. Okay, it's a rani of beak. Okay, and then sweet poison. Okay, so sweet poison also, so you will know why we call it sweet poison. And other is monkswood, blue rocket, bish, and bick. Okay, so yeah, please remember this plant, and this is an aconite. And then, so what is like the most potent, like plant has many parts, right? Stem, flower, leaves, and then roots, so out of them all, the root is the most potent. Okay, it is the most potent, and it is like odorless, it has no any smell. Okay, but taste sweet initially, so it is also, that's why it is known as sweet poison. Okay, like its name. So the mechanism of action of aconite is that it will act on the cardiac cell. Okay, so how does it how does it hamper the cardiac cell, making it a cardiac poison? It will disturb the iron balance of the cardiac cell, right? So that will lead to cause arrhythmia. Okay, especially ventricular tachycardia. Okay, and it is the principal cause of the death. This is the main cause. So what are the signs and symptoms of the aconite poisoning? So it's a poison, right? So poison means you eat the poison. Okay, so what happens is gastrointestinal signs. You can see the initial signs that includes nausea, vomiting, diarrhea, burning in the abdomen, right? And then it is followed by a sensation of burning, tingling, and numbness in the mouth and the face, and then all over the body. And the other includes cardiovascular features, that is a hypotension. Okay, so if the person has like a high bp, like bp will fall down. Okay, and then the heart rate, okay, that is known as bradycardia, it will fall down. And then sinus tachycardia. Okay, sinus will like the sinus of the heart, it will cause many like a fluttering movement, tachycardia it will cause. And then ventricular arrhythmias. Okay, and the other features are sweating, dizziness, and then so difficulty in breathing, headache, and confusion. Okay, and there is one very one very clinical feature you can see, that is known as hippus pupil. Okay, so what happens is the cardiac poison of aconite, what it does is it will first pupil will it will cause the pupil to contract first. Okay, and then first contract and then dilate. Okay, contract dilate, and then in the later stage the pupil will remain dilated. Okay, so that is known as hippus pupil, so don't forget that. And the death, okay, it is a cardiac poison, it will the death will be due to arrhythmia. So the fatal dose of the root of the aconite is 1 gram. Okay, very easy to remember, but the aconitin is 2 to 5 milligram. Okay, and the fatal period is 2 to 6 hours. Okay, that is very important. So treatment, how do you treat it? So treatment includes close monitoring of the blood pressure. Okay, because it causes bradycardia. Okay, so you have to maintain the blood pressure, okay, bp, and then cardiac rhythm as well, because any kind, so many kind of ventricular fibrillation, sinus tachycardia, and all. So and also you have to treat means like eliminate the cause cases, you have to like take it out of your body, right? So you have to do gastric lavage with lukewarm water. Okay, and a weak solution of the potassium iodide or tannic acid. Okay, so potassium iodide weak solution, lukewarm water, and you can gastric lavage. That's the treatment. Another one is major physiological antidote is atropine. Okay, so atropine is not only used in aconite, but you have already studied about in organophosphorus poisoning. Okay, and acotine. Okay, so aconite. Okay, so atropine we use it in the 0.5 to 1 mg IM. Okay, so we do that, and then IV. Okay, and then it is used to treat bradycardia, and other are symptomatic. Okay, so what are the postmortem appearances? So there are no any like characteristic feature for aconite poisoning, but you can see the features of asphyxia. Okay, so you will read about that also as well. And then what happens in the stomach? Okay, so stomach and duodenal mucosa ले चाहिँ के देखाउँछ भन्दाखेरि congestion. Okay, it is all congested, and then all the visceral organs. Okay, so aconite, you can just remember that aconite in the postmortem appearance shows congestion of vital organs. Okay, so medical legal aspect is it is an accidental poison. Okay, commonly because people don't know that is a very poisonous plant, and then they like play with it or get like even 1 gram can be fatal, right? So and in the case of aconitin, it is only 2 to 5 milligrams, so it can be accident, it's very common. Okay, and then homicidal, someone if they have a very profound sound knowledge of how to kill and get away, they can use aconite also. Okay, and then suicidal often. And then cattle poison, the cattle, the cows and the goats, they can eat it by mistake and all that. And another is arrow poison, so you have to, if you have to kill something, like kill an animal, exotic animal like deer or any kind of, then so what do you do is take an arrow and then put some aconite on it, and then you kill the animal. Okay, so this is an animal, it's eating on its own, bichara, है ना. So it's a very rare exotic animal. So what you do, you don't have a gun, so you put like the aconite, you know on the like arrow, and then you hit it, and then it will die. Okay, so that's how arrow poison works. And for criminal abortion, okay, so like if someone got pregnant, like, and by unwanted pregnancy happened, and they can't take any kind of help, medical help for abortion, or due to many causes, like no proper healthcare, medical healthcare facilities, or by law of any country, or by the stigma and the taboo that revolves around the abortion. So some people get desperate. Okay, and then they use, not desperate, I would not say it, but they have to, like, they want to get rid of the baby, right? So they do it by themselves. So as a popular DIY, they say in the internet, it's very trendy, so they do it themselves. Okay, abortion is very dangerous thing, right? So it's a very complicated and critical thing. So some people will use the aconite and then root, and then they will insert it into their uterine, like vaginal canal, then it will cause abortion of the baby. So yeah, that's a criminal offense, so it also should be known. Okay. Mm. So, what are the ideal homicidal quantity qualities of the aconite? So, it is white, odorless, and sweet in taste. Okay, that sounds like pretty good qualities to me. And then small fatal dose, and then it can't be detected in viscera. Okay, so if you kill someone with aconite, then if they do or run all the tests, even so many tests, then they can't find the toxins, in viscera, and then it will also resemble heart disease. Okay, so it is easily available and it will cost nothing. Okay, so this is very important thing. This is the ideal homicidal qualities of aconite. And now we have to know that the most commonly used homicidal poisons are arsenic and aconite. Okay, so it's very important thing. Next thing is quinine. Okay, so quinine is like, it comes from a plant, right? So it's known as cinchona plant. Okay, cinchona plant. Okay, so it is bark. Okay, it is the bark from various species of cinchona plants containing quinine. So quinine, it is also used for making anti-malarial drug, right? So that is also important. So the medical use of quinine is currently limited to the treatment of malaria. Okay, you should also know that. And another unintentional source of poisoning is its use as an adulterant in the heroin for street use. Okay, so some people, what they do is like all these dealers, the heroin dealer, for example, like they want to make more money from less heroin. Okay, so what do, they will mix some, so this is the pure heroin. Okay, so they will add like 80% of the pure heroin, and then 20% of quinine. Okay, so they will mix it and sell it saying it's 100% pure. Okay, so these dealers, they are very bad. Okay, so they do like adulteration of the food. Okay, adulterant for street use. Okay, so this is unintentional source of poisoning. So if like heroin users can get like heart attack and then all. Okay, so what is the mechanism of action? So it is a strong protoplasmic poison. Okay, it is a protoplasmic. Okay? It attacks the protoplasm of the cell. Okay, with anesthetic and sclerosing action. Okay, and then what does it do is it will cause severe cardiovascular toxicity. Okay, that results from their sodium channel blocking effect. So there are like, this is a cell, so it will have sodium, sodium, potassium, and sodium also. Here are other like gated ion gated channels, right? So like it will block the sodium channel. Okay, sodium channel. Okay, so if this is blocked, then what happens, it will result in toxicity, cardiovascular toxicity. Okay, and then it will cause cardiac arrest. Okay, shock, hypotension first, and then shock, and then arrhythmia, and then cardiac arrest. So it will, what does it do on the brain? So it will stimulate and then depresses the central nervous system, right? So that's it. Another, what are the other thing, okay, sign and symptoms of quinine poisoning, okay. So other signs and symptoms of quinine poisoning: headache, okay, and then ringing in the ears, tinnitus, and then this would be subjective tinnitus, okay. And then pupils will is dilated, okay, it will be dilated in eye and then fixed, okay, it won't like a light perception of light, that will not occur, okay. And then mental confusion, okay, and it will have confusion of thought, and then abdominal pain, vomiting, diarrhea, and then methemoglobinemia, and then hypertension. These are the cardiovascular cardiovascular side effects, okay. Arrhythmia, and then in large doses it will cause hemolysis and death, okay. We are studying about quinine, okay. So other features include coma, convulsions, and oculotoxicity, okay, even in the eye, okay, and ototoxicity sometimes, ringing of the ears and all. So these are the signs and symptoms. So what is shinkonism, okay, sorry if my pronunciation of that is wrong, but shinkonism, it is caused by the repeated and therapeutic doses of overdose of quinine, okay. So that will lead to, these are like anti-malarial drug, like anti-malarial drug. So in pharmacology you could have also studied about it, so if you haven't, so let's know about it, okay. So it will cause tinnitus, vertigo, and then deafness. Like this is related to ENT, okay. ENT. And then diplopia and blindness, that is ophthalmo, okay. Skin rashes, derma, hypoglycemia, this will come under like endocrinology. And then cardiac arrhythmia, that would come under cardiovascular, okay. So these are the like side effect of shinchonism, okay. That is ear, eye, and then skin, and then like hormones, and then heart, okay. So in ear we have tinnitus, vertigo, and deafness. And then in ophthalmology we have like diplopia, and then blindness, even blindness, okay. Toxicity can result in. And then in dermatology we have skin rashes. And in the endocrine, it will cause hypoglycemia, okay. And then it like so many complications can occur from this, okay. And then cardiac arrhythmia, that is a cardiovascular system, that is also an important side effect of chinchonism, okay, quinine poisoning. So what is the fatal dose? Fatal dose is 8 to 15 gram, okay, 8 to 15 gram in quinine, okay. And then we have fatal period is, it will take up to 6 hours, okay, 6 hours to work, okay. So treatment, it is treated, how it treated: stomach wash with concentrated solution of magnesium sulfide, MgSO4, which is left in stomach for rapid elimination of poison, okay. So concentrated solution of MgSO4, okay, MgSO4. So that's it. In the aconite, what did we do? In aconite we took some atropine, right? So don't forget that. And also we do like lukewarm water with weak solution of potassium iodide and tannic acid, and then atropine, and then symptomatic, right? So remember that as we study about quinine as well, don't forget aconite. So in the quinine we have to like stomach wash with concentrated solution of MgSO4, which is left in stomach for rapid elimination of poison, okay. And then activated charcoal. And then we have to to promote the diuresis, we have to also put some like IV fluids, okay. And then what happens is bilateral stellate ganglion block, okay, bilateral stellate ganglion block, it is for the immediate return of the vision in quinine, okay. So this is very important, bilateral stellate ganglion block, okay. And then in the postmortem appearance, what happens is congestion of the visceral organs, okay. So postmortem appearance, what happens is a visceral organ will be congested, and then if there is a high dose, hemolysis can occur. And then renal tubules, okay, renal tubules may be blocked by the hemoglobin, okay. So these are the quinine. And then what is the medical legal importance, okay. So it can be due to accidentally, okay. And then also there are some people who use quinine in excessive doses in the hopes of achieving abortion, okay. And then for the suicidal, but it is rare, okay. Nobody goes to a shop and then buys like give me some anti-malarial drug, and then they take it and then they eat it. That's very rare, but it is possible though, okay. So accidentally, it is more common, okay, quinine poisoning. So now let's go back to let's move forward, not back, sorry. Let's move forward to nicotine, okay. So you know this very well, I think, okay. So it is an alkaloid found in the several species of tobacco plant, okay. So C10H4N2, that is the nicotine that chemical formula for the nicotine. And so what it is a extremely fast acting poison, okay. So it acts very fastly. And all parts of the plant are poisonous except the ripe seed, okay. So everything about the nicotine is poisonous, the plant, okay, like a tobacco plant, but it only the like ripe seeds are not poisonous. Okay, so what is happened, the dried leaf contains 1 to 8 percentage of nicotine. Okay, so like in cigarettes, what they do is, if you have ever like seen a cigarette or taken a cigarette, you should probably have seen the leaf, the dried leaf stuff that inside that the people smoke, right? So it contains about 1 to 8 percentage of nicotine. Okay, and it is either smoked or snuffed or chewed, okay, in any way that it is found out. Okay, so one cigarette, it is equals to, it has like 15 to 20 gram. One cigarette has about 15 to 20 milligram of nicotine. Okay, and out of which 15 to 20, only 1 milligram is absorbed. 1 milligram is absorbed by smoking. Okay, and then nicotine is rapidly absorbed from all the mucous membrane, like lung and skin. Okay, and all that mucous membrane, lung and skin. So what is the mechanism of action of the nicotine? Okay, so it acts on the autonomic ganglia, that initially stimulates, but in the later stage is depressed and blocked. Okay, it acts on the autonomic ganglia, ANS, autonomic nervous system. Okay, stimulates first and then it will depress. Okay, it will later stage, it will depress. So it always acts on the somatic neuromuscular junction. Okay, somatic neuromuscular junction and the afferent fibers from the sensory. Okay, so neuromuscular junction, NMJ, it will act on the somatic. Okay, somatic neuromuscular junction and afferent fibers. Okay, and afferent fibers from sensory receptors. Okay, and it also stimulates initially cerebral and the spinal systems, but later paralyzes them. Okay, so whenever, if someone, you ask who takes like cigarettes, so what do they tell is, first they get a little bit of like excitement from smoking it, right? And then after that, if you ask them what do you do after getting excited, then they will like probably answer like they will like to like relax. So this is due to it stimulating initiates the cerebral, okay, and then spinal centers, but it will cause later them to paralyze. So yeah, so that's what happens. Okay, and it suppresses appetite, okay, while increasing the basal energy expenditure. Okay, so that's why people who take cigarettes, and it will, so how does it work, it will suppress the appetite and then it will increase the basal energy expenditure and then it will lead to the weight loss. So that's how it works. Okay, but don't go on and take nicotines just for the sake of weight loss. Okay, I think I should have kept a disclaimer on this video saying this is not a medical advice and all. Okay guys, this YouTube channel does not represent any kind of medical advices. Okay, it's just an educational like educational also, and let's start it together session type, right? I hope you get it, but nobody's watching, so yeah. So what are the signs and symptoms of acute nicotine poisoning? Okay, acute nicotine poisoning is burning sensation in the stomach and abdominal pain. Okay, and then nausea, vomiting, and hypersalivation also occurs, and then muscle weakness also occurs, and then diaphoresis means like sweating. Okay, excessive sweating, it will occur, and then tachycardia, and then hypotension, and then sometime it will cause meiosis, and then coma, paralysis, and arrhythmia. So acute nicotine poisoning signs and symptoms include nausea, vomiting, burning sensation in the stomach, muscle weakness, and then excessive sweating. Okay, diaphoresis, and then tachycardia, hypertension, and then coma, paralysis, etc, etc, etc. Okay, but in the chronic nicotine poisoning, what happens is, if someone is taking like cigarettes or what is called tuna, no, not tuna, chaini khaini or whatever, tobacco, so what happens, then they have chronic nicotine poisoning. Okay, so what happens is they have cough and wheezing, and then dyspnea. Okay, and then anorexia means they don't feel any kind of like hunger and all, and then vomiting also occurs. Okay, and then diarrhea, anemia, even sometimes tremors, and then irregularity of heart with extra systole. Okay, so what happens is normally PQRST, right? So this is the normal, right? So if you take nicotine for a long time, so irregularity of heart beat with extra systole. Okay, so systole, it will have some kind of, and then on the occasional pain of attacks of pain suggesting angina. Okay, so it is also called myocardial infarction. Okay, so like antioxidants, oxidants, it will cause like many kind of like side effects, due to which or like it will, the arteries will get clogged, you know and then it can lead to MI, so anginal pain. Okay, that is also important. So fatal dose is 500 to 100 milligram. Okay, 100 milligram of nicotine, and then another is of crude tobacco, sorry for that, 15 to 30 gram of crude tobacco, okay, and then the fatal period is about 1 to 5 hours, okay. So it's very important. So the fatal dose is 5 to 50 to 100 milligram of nicotine, but if the person is like chewing a crude tobacco, then it is 15 to 30 gram, okay. That's very high, okay. Fatal period is 1 to 15 hours, okay. So what do we do in the like chronic nicotine poisoning? We do like in even in the acute, okay. So we do solution of tannic acid and then bowel evacuation, okay. Tannic acid, bowel evacuation, and then activated charcoal, okay. Activated charcoal. And then digoxin, digoxin, it's a very good drug, okay. So it will specific antibody fragment, okay. Digoxin specific antibody fragment, that is given 0.4 to 0.8 mg in IV, and then if the patient, if say for 16 hours, patient usually survives. So the target is to keep the patient alive for 16 hours, okay. So these 16 hours, if the patient is like saved anyhow by symptomatic or any kind of all this treatment, like specific treatment, like solution of tannic acid, bowel evacuation, activated charcoal, and then the dioxin sensitive antibody titer, antibody fragment, and then so yeah, that happens, okay. The next is oleander, right? So this is oleander. So it is known as the Cascaliba thavaceae, okay. So it is also called kaner, okay, kaner or kanail, okay. So Cascabella thavaceae, okay, Cascabella thavaceae, that is the oleander, okay. So its active principle are cardiac glycoside, okay. So it has like this active principle. So it is thevetin and cerebrin, okay. Oleander, okay, oleander, OLEAN, oleander, okay. So its active principle are cardiac glycoside, in which there is a thevetin and cerebrin, and it is present in the milky juice of the plant, which exudes from all the part of the plant, okay. And inhibition of the potassium and sodium ATPase, okay, mainly in the myocardium, okay. So what it do, it is thevetin, okay, thevetin, oleander means thevetin, and cerberin, okay, cerberin, thevetin and cerberin, thevetin and cerberin, thevetin and cerberin, thevetin and cerberin, oleander, thevetin, cerberin, and it will also hamper the sodium potassium ATPase, okay, ATPase. So it will also inhibit, okay, and then it will lead to cardiac toxicity, okay. So this is oleander, okay. So thevetin and cerbera, okay, thevetin and cerberin, all right. So that's all. So now only two to three like slides are left. So what happens is, initially gastrointestinal symptoms are seen in the form of anorexia, okay. GI symptoms: anorexia happens, thirst happens, nausea happens, vomiting, and then abdominal pain, okay. This is like typical, like you should know already. And then another is diarrhea may also be seen, okay. So diarrhea can be seen, and then later the cardiac symptoms appear in the form of fainting, okay, in the presence of arrhythmia and extrasystole, okay. Fainting happens, and then arrhythmia happens, and then extrasystole, arrhythmia and extrasystole, right. So initially pulse may be fast, okay. What happens initially is pulse may be fast, but later slows down, and heart block may be seen on ECG, right. And then on the ECG, changes in the form of flattened or inverted T wave, okay, and then depressed ST segment, prolonged PR interval, and heart block and ventricular tachycardia may also be seen. So on an ECG you see PQRST, right. So this is PQRST, right. So this is normal ECG, right. So what happens is, in the form of flattened or inverted T wave, okay. So this is normal. So flattened means P, so we have to like flatten or invert the T, okay. So PQRS, no T, okay. So it's either be flattened or inverted T. So something like this would occur. Normally this should have occurred, but this occurs, okay. So this is what you will see. And then T wave, and then investigated prolonged PR interval, okay. So depressed ST segment, okay. So depressed ST segment can also be occur. So PQRST. So this segment, ST segment can be depressed, okay. And then like what happens is prolonged PR interval, right. So this interval, prolonged PR interval, means this will be more PR interval, okay. PQRS, okay, P and R, okay. Normal it should have been like something like this, but prolonged PR interval, okay. And then heart block and like tachycardia, okay, VFib and ventricular tachycardia, all that occur. And then pupils may be dilated, okay, mostly it is dilated. And then in visual disturbance like fleeting spots, yellow or green vision, okay, yellow or green vision in seen in oleander, okay. And then drowsiness and coma follows, and then delirium may be followed by hallucination or convulsions, and death due to VFib, okay, VFib in oleander, okay. So like it's fatal dose and fatal period can be variable, okay. So how do we treat it, okay? So we can treat it by like gastric lavage and activated charcoal, okay. And then tannic acid also, as we have already studied about it. And then we have to correct the hypokalemia, hypercalcemia, and hypomagnesemia, okay. So hyper is calcium, other all are hyper, okay. Hypo, sorry, hyper is calcemia, other are hypo. So that is includes kalemia means potassium, and then magnesium means like hypomagnesia means magnesium, okay. And then for bradycardia, atropine also is can be used in oleander poisoning. And then deoxin immune fab or digoxin specific antibody fragments can also be given. So what is the medical legal aspect? So root and seeds are used, okay. So medical legal aspect is root and the seeds of the oleander are used for criminal abortion, okay, criminal absorption. And then for the suicidal and homicidal purposes. And then as a cattle poison also, like oleander is very like important, that is significant. So that's it guys, thank you for listening, thank you for standing by. If you like this video and like want some more, on certain topics that you feel like I could help you, please don't forget to like leave a comment, without any hesitations. I'm always open to teach you guys. Yeah, I hope you like it. If there are any suggestion that you'd like to make for me, then please leave a comment below. Thank you so much. Please consider subscribing.